Well, Nick Maynard is a consultant surgeon at Oxford University Hospital and was in Gaza recently working with medical aid for Palestinians. Nick, welcome. You were in Gaza a few months ago. Tell us what you saw, particularly in the hospitals where you worked.
Well, thank you for asking me on. I saw appalling scenes every day there. I've been out there multiple times in the last 2 years, and each trip I go on, it's much worse. I saw appalling injuries from explosive injuries from bombs, every day mass casualties. I saw on this most recent trip multiple gunshot wounds in young teenagers who've been shot by the Israeli military at the food distribution centres. And I also saw catastrophic problems with malnutrition, people dying of starvation, newborn babies, children, adults. Particularly my patients who had severe injuries that we operated on, they were so malnourished that many of them died because they were so malnourished. So I saw the most appalling scenes, war crimes every day, and it's getting worse by the day.
We have this fragile ceasefire. Some aid is getting into Gaza. Is this aid reaching hospitals and patients efficiently and effectively?
No, it's not. I mean, of course we welcome any aid coming in, and any aid coming in is better than what they've been experiencing over the last 6 months or so. But nothing like enough is getting in, and it's not getting to the hospitals in any quantity at all. We need to have unlimited access for aid, multiple humanitarian corridors to open up. Most importantly, we need Rafah to be opened to allow all the aid to come in. So, yes, we welcome aid, but nothing like enough, and it's not making any significantly material difference to the hospital's ability to treat patients at the moment.
Beyond emergency care, I wonder what kind of long-term medical and psychological rehabilitation will Gaza's population need?
Yeah, and it's a really important point you raise. There are nearly 400,000 people with chronic diseases in Gaza which have not been treated remotely adequately over the last 2 years. There's probably 12 to 15,000 patients with cancer not being treated. So all of those people, many people are dying from these excess deaths. That's a term we became familiar with during COVID. The Lancet Medical Journal, their latest estimate is that there are over 350,000 people in Gaza who've died of excess deaths of non-trauma related diseases, for which malnutrition is a major contributor. That's nearly 15% of the population. The needs of the population of Gaza are just enormous in terms of treating these chronic diseases. And even if there were unlimited aid going in today, which we pray for, there's unlimited aid, unlimited food, there would still be many more deaths from these diseases which have remained untreated from the malnutrition.
You're back home now. As you take stock, I wonder what struck you most personally during your mission, perhaps a patient, a colleague, or a moment that stays with you.
Yeah, I mean, there are many horrors, and we've witnessed the absolute depths of humanity during these last 2 years, from October the 7th and the subsequent 2 years. But we've also seen some of the most wonderful examples of humanity, and the behaviour, the dedication of the Gazan healthcare workers, whom I've known for many years, having been going out there since 2010, but particularly their dedication in the last 2 years. It is beyond belief how they've been able to work during this time. Their commitment, I mean, they're all starving, they're all hungry, they've all lost huge amounts of weight, they're all chronically ill, but they're working day in, day out to try and save the lives of their fellow civilians. So many of the healthcare workers, I think, are just truly inspirational. And there are patients I'll remember forevermore. Little Habiba, 11-year-old girl who had terrible chest injuries. I spent the whole of one night operating on her just a couple of months ago. And she died because we couldn't feed her. She died because there was no medical nutritional support to give her because it was all being refused entry by the Israeli blockade. She would have survived if we'd been able to feed her, but we had no feed to give her because none of us were allowed to bring it in. So I'll remember Habiba forevermore. She died an unnecessary death entirely because of the blockade. There are other patients I'll remember, but yeah, very, very sad memories.
Nick, it's good to see you, and welcome back, and thank you so much for your time. Nick Maynard, consultant surgeon at Oxford University Hospital.